situation. And anyway, I don't know, but it's not raising an alarm. It is that we should do the right thing and as fast as possible.
Exactly. And considering the fact that there is supposed to be a 500 billion naira stimulus, that has not got into the National Assembly. To tell you how slow. It's all right. Nancy, you take it off from here.
Okay. All right. Good morning, everyone, and thanks for joining us. Of course, this is the business. This is where we look at the economics of the pandemic, because I don't even know what business to talk about right now. There's no business than coronavirus that is ongoing right now. But on this segment, we try as much as possible to break down everything happening in the world of the economy, as economies are also responding to the coronavirus spread. Today, I will be chatting with, that's in our conversation, talking about the interview. I will be chatting with Laoye Jayola, who is the Chief Executive Officer at the Nigerian Economic Summit Group, that is NESG. He will join me via Skype in a short while. But let's break down some pieces of information for you, especially those that have been coming in from the World Bank and the IMF. The World Bank, IMF, and most of these multilateral organizations have been in the news even since this coronavirus started. Last week, I did chat with the World Bank country director for Nigeria, as well as the World Bank chief economist for Nigeria. He did tell me that there are a lot of things ongoing right now. The Ministry of Finance meeting with them and seeing what would come out of it. But this morning, the International Monetary Fund did say, that was on Sunday actually, said that Nigeria and other African countries need an estimated $114 billion to fund a campaign against the outbreak of the coronavirus disease on the continent. A statement issued after a meeting of African leaders, bilateral partners, and multilateral institutions jointly convened by the World Bank and the IMF. The fund says it has mobilized partners in the fight against COVID-19 in Africa, adding that official creditors have mobilized up to $57 billion for Africa in 2020 alone, including upwards of $18 billion from the IMF and the World Bank each. The private sector coalition against COVID-19, CACOVID, is set to distribute 23 billion naira worth of food to 10 million Nigerians from next week as part of its efforts to mitigate the impact of the lockdown order by the federal and various state governments. Chairman Dangote Group, Aliko Dangote, said the palliatives will be shared across the 36 states and in all 774 local governments in the country, noting that the coalition is not only involved in medical intervention, but also in food distribution to Nigerians and about 5% of Nigeria's 200 million people, and hopes to reach 1.6 million households in the country. The Central Bank of Nigeria has listed insurance cover as collateral to be considered for beneficiaries to access the 50 billion naira intervention fund for small and medium enterprises and the pharmaceutical sector. In the guidelines released for the SMEs fund, the CBN stated the collateral to be pledged by beneficiaries under the program shall be as may be acceptable by NISOL Microfinance Bank, but may include any one or more of the following: movable assets duly registered on the National Collateral Registry, simple deposit of title documents, deed of debenture for stocks to acceptable guarantors, personal guarantee of the promoter of the business, life insurance of the key man with the National Microfinance Bank noted as the first loss payee, and comprehensive insurance cover over the assets. All right, at this point, let's quickly take you through the markets update. We're seeing some kind of, some kind of recovery across some global markets. We're seeing what's happening in China, but it's not really a good news so far, even for the price of oil. I'll come back to that in a bit. The Nigerian equities market closed last week in the bullish zone. The All-Share Index was up by about 7%, bringing the year-to-date loss to about 15%. The number of shares traded last week ended at 1.49 billion shares at a value of 12.89 billion naira. It's remote trading that is going on. There is no physical trading on the floor of the Nigerian Stock Exchange. Market capitalization closed at 11.94 trillion naira. Let's move over to other African markets. For Johannesburg Securities Exchange, it opened today in the negative territory. South Africa is still battling a recession, so it's, a double whammy for the country right now. The rand has also lost so much value against the US dollar. I think it's trading around 18 or 20 to the dollar. The Ghana Stock Exchange opened in the downside 0.26% at 2,107. For Ghana, there was an address yesterday by the president. It's a televised address, and he did say that he will open Ghana gradually. That's from the lockdown, places like the capital, Accra, but there will still be bans on schools and some other centers. But we're expecting to see perhaps, and talking about Ghana, they've tested, I think, over 60,000. They've done tests for over 60,000 people. And for Ghana, it's the International Monetary Fund gave Ghana $1 billion last week to fight coronavirus. For Kenya, it was upside by about 0.26%. EGX 30, just marginal drop there. Moving over to European stocks, they opened slightly. US, that's it. Open slightly lower today as the futures market investors are weighing the latest coronavirus news along with a sharp decline in US crude prices. We saw US crude prices drop to $14 to $13 last week. That's the WTI. Brent crude is trading this morning at $28. Let's move over to European stocks. Open slightly higher today as global coronavirus development remain in focus along with a sharp fall in oil prices. For Asian specific stocks, they were mixed today as China cuts its benchmark lending rate. China cuts its one-year loan prime rates to 3.85% from 4.05%. The 5-year loan prime rate was also reduced to 4.65% from 4.75%. This move marked the second cut to the loan prime rate for 2020. U.S. crude prices plunged in afternoon Asian trade today as traders continue to fret over the slump in demand due to the pandemic. Brent crude is trading at just some seconds ago at 28. You're seeing on the board now at $27. Gold is trading 0.5% down at 1676 an ounce. Palm oil is doing 23.52. All right, that's it. Let's quickly take a break. And when we come back from the break, it will be time for our interview with the Chief Executive Officer of NESG, Laoye Jayola. That's the Chief Executive Officer of Nigerian Economic Summit Group. He'll be joining me on Skype shortly. But what you're seeing on the board right now is that you can interact with us on all our social media platforms. On Facebook, we're there, Moneyline with Nancy. On Twitter, we are there at Moneyline AIT. You can also find me on Twitter. You follow interesting pieces of news, especially at this period, what's happening around the economy. We'll track that for you. On Instagram, we're also there, _Moneyline with Nancy. On Instagram, you can also find Nancy Lo. On YouTube, Moneyline with Nancy. I get a lot of comments as regarding, we can't watch this because there's no light. You can also follow us online. You can watch this episode. We are streaming live now on the website. You can also see other episodes of the show on YouTube. That's the website there, www.moneylinewithnancy.com. And for AIT, you can also join the conversation. You can find AIT, the website, www.ait.life. And the official handle of AIT is official AIT Live. I see some people even on social media, on Twitter, they still tag AIT online. That is no longer the official handle. It is official AIT Live. Let's quickly take a break. We'll be right back. All right, welcome back. In case you're just joining us, it's COVID-19 Watch, and this is the segment where we take you through the economics of the pandemic. Just before we establish connection with my guest, Laoye Jayola, who is the Chief Executive Officer at NESG, let me just, give you a rundown of some things happening. I'm aware that Lagos State has set up sampling stations, that's COVID-19 sampling stations in about 20 local governments. According to the Commissioner for Health in Lagos State, he did say, I think, about 3 local governments do not have coronavirus as at when he spoke, because these things change. And I think there are 37 local governments in Lagos. So the issue right now is that we're seeing a lot of community transmission is there already, because there are a lot of people even getting contracting coronavirus without the normal things that the NCDC had put together earlier, in terms of if you are close to someone that was infected, or if you traveled, your travel history and all of that. We are seeing transmission right now around communities breaking that protocol. So we really need to be careful right now as Nigerians. Even those of us that go out, perhaps to buy food, those days that the government, like in Abuja now, I heard is Wednesday and Saturday, to go out and buy food and essentials between 10 to 2 p.m. I do think if we are going out to buy such things, we should all have our face masks, because no one is immune to contracting this virus. There was something that I saw on CNN yesterday, Don Lemon's program, and they did say that, in fact, there was a research that was done that there was a man that had coronavirus in a restaurant. Social distancing was there, but they found out that almost everybody in the restaurant had it. How come? Perhaps the air conditioner. So we're seeing this COVID-19, changing. This is a virus that the world is still studying, and we shouldn't take it for granted as Nigerians. We have 200 million plus people. How many have we tested? We should go ahead with rapid testing. The samples should be taken quickly, and the results should be brought out quickly. I do know that it's a burden right now for the frontliners who are healthcare professionals. They are also getting infected. Who is taking care of them? We need really a holistic, approach to all of this, and not everybody doing stuff in silos. This was one of the fear I expressed some weeks ago, that when it gets into community transmission, I just hope that we'll be able to contain it, so that it's not just an epidemic in Nigeria. We saw what happened at the burial ceremony of the Chief of Staff last week. That was not a good eyesight at all. We are preaching maintain physical distance, and we see a lot of people there. How many of us know how many they've gone into the society and all of that? This is something we should not take with levity, and nobody is immune to contracting coronavirus. Let's quickly take a break. When we come back from the break, the show continues. Okay, welcome back to the program. My guest is joining me right now. He's Laoye Jayola, the Chief Executive Officer at Nigerian Economic Summit Group, NESG. He's joining me from Lagos, I suppose. Good morning to you, sir. Welcome to the program.
Good morning, Nancy, and thank you for having me.
Good morning. Speak to me about your assessment of present situation, our fight against coronavirus. I did express some concerns just before you came in, before we connected with you. We're seeing community transmission right now. There's no pretense about it. There's no politicizing about it. We should say it the way it is. What is your current assessment of the present situation?
Well, again, let me say that to a large extent, they haven't done too badly. I'm worried about the level of testing that we've done, because we need to test and test and test. And as at the last result, we have tested just barely about 7,000. And if a nation like Ghana can do 50,000 plus, and other nations have done much more than that, then you know that we haven't done much. And about last week, the SCDC released their guideline on how to improve on their testing. And maybe the reason we're seeing higher figure in Lagos now is because of improved testing. My fear is that as we do a lot of the testing, you are going to see much more cases.
Why do you think we've not been able to do all of the testing, even with all the support coming in from even the private sector and the government? The government is indeed putting huge resources, they say, to this, and yet we're still seeing barely, not up to 10,000 tests that have been done. Like you said, the last count that I have of Ghana is 60,000 tests they've done, and they still have 18,000 outstanding tests that they are waiting for their results. Now, that was why the president came out yesterday in a televised broadcast to say that he is thinking of, reviewing the lockdown because they are quite prepared. In Ghana, for example, they have testing facilities in 16 regions of the country. And this is our country, 200 million people. Come on. Are you worried with the sense of urgency or the sense of no urgency that we are putting in all of this?
Well, everybody should be worried that we haven't done sufficient testing. If you look at the last count, I think we have, apart from Lagos, I have 3 centers for counting. Abuja has 2 centers. We have again in about 8 other states. And even in Lagos, you find out that all the molecular labs and co we are not ramping it up as much tests as we're capable of doing. Maybe because we don't have enough of those test equipments, those test kits, those test specimens. Which is why, again, though there is much more money, but there's a need for, what I found out is that we didn't do significant coordination on time, because while people are worried about ventilators and all the isolation center, we should have paid particular attention to testing, and contact tracing, and then the isolation center. So one is worried. But again, they plan to wrap it up in the next May and September, and I hope that we do that very quickly, because until we begin to test, we cannot begin. People can't go out, because all the social distancing that we've been doing will then not be of much impact, because you don't know who to walk away from, and that's why you realize that because they didn't have sufficient test equipment. That's why you realize that they prioritize who and who they should be tested. So even if you call and you want a test, they won't attend to you. But happily, Lagos just rolled out about, in all the local government, they've rolled out about 26 centers where you can then be tested. And that's what they've done this week. So we hope they'll ramp that up very quickly, and then we'll get more people tested.
Are you worried that the way Nigerians are also handling the level of information around coronavirus? What I mean is, for example, some of the protocols we're supposed to adhere to, physical distancing, social distancing, we're not doing that. For those that can afford to do that, I know that Nigeria is a country with millions of poor people. Most poor people do not live in good settlements. Some stay in slums. They don't even have running water. So are you worried with the kind of information that is going on right now in terms of not adequate information in terms of social distance? And the media is doing a lot, but perhaps the lot is not also enough. Because I've had experiences, I've spoken to a few people, even in some kind of settlement, they're like, no, that coronavirus, they are beg. Now, rich man disease and all of that. So do you think that there should be a new strategy at communicating with our people?
Well, again, I think there's enough information out there, but it's all a joint effort. We all have to ensure that we let our community know that, either through the churches, the community leaders, and a lot of us have a responsibility to ensure we let our neighbors know that, because once somebody is not safe around us, we all then can be affected. Government should continue to do what they are doing around that, ramping up information. The social media it has quite a lot of that, but I think we all need to do more. But again, people need to believe it. Maybe now that we are beginning to have some instances around us, maybe Nigerians will begin to believe it. Now, again, because people are daily paid workers. I mean, data have it that as much as about 70% of Nigerians live on daily, weekly wages. And so long as you lock them down and they don't move, they then begin to ask themselves, why are we sitting at home? Which is why, again, some palliative measures must be well distributed in such a way that people can and then be obedient to the lockdown rules. But know that we are not complying as much as we should do, especially in areas in Lagos that are densely populated. You realize that very soon you're beginning to see increased number around Alimosho and some other areas in Lagos. So we need to be very careful about that. I'm particularly worried that you are seeing numbers and kind of ramping up again. So these are things that we need to watch and ensure that we pay particular attention to what we're doing. But all of us have that responsibility. It's the government, traditional rulers, community leaders, church workers, and all of us should join hands together to make sure we do this. And that's why the private sector is putting significant resources and support in this area to ensure that we help government in doing whatever it is government needs to do. But we need to improve more on our coordination.
Okay, I will come back to coordination. I'll come back to state preparedness in a short while, some of the issues that I took away from your remarks. But let's come back a bit because we're facing a health crisis as well as an economic crisis right now. And for Nigeria, it's a double whammy. Brent crude price at about $28 just before I came into the studio. We saw what happened with WTI, US WTI, about $14, $15 Saturday and Sunday. So it's not even good news for us right now. Like I said earlier, we should be firing from all cylinders because it's not going to be good, and there's no need to paint the story in a very colorful way because it's not colorful. Do you think, are you seeing enough from the NCDC, as it were, in terms of updating their information, updating their protocols? Like I said before the program, I was watching a program yesterday on CNN, precisely, and they conducted a research. The research was about, there was someone that had coronavirus that went to a restaurant, and social distancing was observed. But they found out that almost everybody in the restaurant was infected with the coronavirus. Why? They found out because of the air conditioner. So that means that the air conditioner also transports the droplets into the thin air, so it's traveling. So these are also some of the things, when I saw that yesterday, I was like, come on, these are the kind of information too that the NCDC need to be abreast with. So also, like, really update the information that we are chewing on a daily basis. You understand me, sir?
Yeah, again, I want to say NCDC is doing the best that they can do. But one thing is very clear, that as we begin to then go out now, I look forward to a time when they'll say, if we must go out, all of us must go out with masks. And happily, you can sew these masks now and have clothes around it. Because you don't know whether it's the air conditioner, whatever it is. To the extent that we haven't done sufficient testing, and we don't know who is a carrier, one of the things that will ensure that once we begin to go out, I would urge everybody to make sure you put masks and then you go out with it. That's what I would recommend to anybody. And that's what I think we should get to that level and begin to tell everybody, like, you know what, if you must be out there, make sure you're covered with a mask and make sure you are well protected. Beyond washing our hands and using sanitizers, these are additional things we should do because we haven't done as much testing as we should.
Okay, let's come to the issue of, just like what you said now, the issue of protecting yourself further. Are you satisfied with the level of perhaps the production of masks? About 3 weeks ago, I did take Sam Hart, who is the DG of in Abia State, in charge of marketing and quality management. He has his guys that are involved in the production of masks and all of that. Are you satisfied with the level of production from our local companies, like what you said, PPEs, masks, and some other protective gears we need to wear? Why I'm asking that question is, for example, in Ghana, the local companies have embarked on production of PPEs, for example. I'm aware that each PPE, those things that the doctors or the healthcare workers wear, is about 70,000 naira it costs, or 75,000 naira. Can we now begin to engage? I know some have been engaged, but I really don't know how, to what extent. Are you satisfied with that?
Well, we cannot be. Nobody will be satisfied because, again, we are not importing these things. We're not even getting them around. But it's good to know that regarding masks, a number of Nigerians are beginning to do locally made masks. Now, I know Sam Hard and his team in Aba are working on some of the PPE. Maybe we need to have, this is when we need to engage our fashion industry, the number of people in that sector to say, this can be what you pay attention to. I mean, if, for instance, in the US, you can have a whole General Motors to avoid the alliance and begin to do ventilators, and many other people are doing ventilators. This is the time for our people who are in the fashion industry to sewing to make sure they take advantage of that and then run and do the PPE. They've done enough. They're doing enough in terms of the mask, but I haven't seen much of the PPE around. And maybe because I haven't gone around, but around the health workers, one of the things I think we have a duty to do is to protect our health workers. Because what is coming out is that we're losing a lot of medical doctors and nurses, either because Nigerians themselves don't tell them people that go to private hospital, for instance. But beyond that, we need to ensure that we do more of this and then protect our people. So it would be nice to see more Nigerians working on the PPE. Quite a few of them are already working on the mask.
Very crucial point there, because the health workers that are the frontliners right now getting infected. We're seeing doctors and nurses even dying from contracting the infection, and also making the hospital system more prone to being a transmitter of this coronavirus, if not checked. So we need to protect our healthcare workers, not just for them, for their sake, and also for the public as well. Let's go back now to what you had said earlier. You mentioned a few states. How do you think the states can ramp up, what their measures so far in terms of also assisting their communities to get tested, production of perhaps some of these PPEs we are talking about, and what have you?
Well, one of the things I found out is that earlier on, when the federal government set up their own the presidential task force, we didn't see enough of the states involved in what they were doing. But over time, you found out that the governors forum tied in there, and whatever NCDC is doing, because they've had a structure that predated this. I mean, it dated back to Ebola and co. They could reach out to the state. So I know the governors are all together and they're in sync with what they're doing. Some of them are trying to do the local mask, but like I said, it will be good enough to see much more of that. And one of the things you see from the state government is that, again, they're doing they are reaching out to the vulnerables, but again, the modus operandi of the distribution of some of these things are things that leaves more to be desired. Maybe after now, one of the lessons we need to learn is that how do you have an effective social register that reaches out to everybody, that we can then plan better in trying to alleviate those that are very vulnerable. The states are doing that, and I hear that these are reports we read. Again, all of us are in-house, and whatever we do online. But the reports we hear is that most of the states are reaching out to their people, but because we don't have a very good social register, the people that need the thing the most aren't getting it. So the states are doing their best. I mean, if you look at it, one of the things you note to date is that the bulk of those people that are infested are in Lagos. Lagos and Abuja alone accounts for close to about 75 to 79%. And maybe because they're entry ports, if you get those ones right and pay attention to mass areas like Kano and the like, maybe we will not have enough spread. But as regards to the other states, I think their governors are doing quite enough of work to contain it, to make sure we don't have those spread. So my concern is deal with Lagos and Abuja, and let's look at areas like Kano that is just beginning to show that sign. And 50 in Kano within a space of less than 1 week is something that should worry anyone.
let me put it this way, that perhaps we are seeing more cases in Abuja and Lagos because perhaps there are a lot of more samplings done there. Don't you think so? So more samplings done there, and there's already community spread, whether we like it or not. What ways can the governors come up with new innovations to fighting this coronavirus outbreak, especially in their states? I'm aware, and I was told, that there are some people that travel cross-border, even in the night. You know, some young people go to their villages, some people still travel, even in the night, amid the lockdown.
Again, you see, well, Lagos and Abuja more because those are entry points. You recall that all the indexes we had from outside Nigeria came through Lagos and Abuja, not too many people in the states. And some of those states began lockdown sufficiently. So if you have cases of 1 or 2 people traveling to their respective states, and what I understand is that each of these state governors have curfew, they have their own lockdown. What we need to do is to ensure we're effective in our contact tracing. The contact tracing thing needs to be very, very important. And we need to, again, let every community know that if you shield one, it's not in your interest. So because Nigerians don't want to die, what I see is that everybody will shout. So we need to have a calling system that allow for easy reporting on any strange movement whatsoever. But what I want to beg Nigerians to do, and what we both of us have a duty to do, is that there's nothing there's nothing to be ashamed of that one is contracted COVID-19. So people don't need to hide it and then create more danger by either going to private hospitals or not disclosing their travel records or what they've seen. We have a responsibility of all following through the NCDC protocol so that we do not we don't make this problem much more problem for Nigerians. So the governors, for now, are trying their best. What I think we all owe this nation the more, both NCDC, the Presidential Task Force, and everyone, is to do enough testing. Until we test, we don't know the end of it. And while we have not, until we test, all we all can do is to do social distance until we test.
Okay, speak to me about the financial resources so far that has been committed to the fight against coronavirus. We've seen the private sector coalition against coronavirus, CACOVID, Aliko Dangote and his team, Central Bank, Herbert Wingwe. I spoke to Herbert Wingwe, Dr. Herbert Wingwe, just like 2 weeks ago or thereabouts when CACOVID came up with that initiative. And he did tell me at that time that in the next few days or weeks, we will see what they are doing now. So I'm happy they've ramped up in terms of food distribution to Nigerians and, possible construction of 200 bed space at the isolation center in Lagos. How about other financial resources that government is using to fight this COVID? Are you also worried about issues of transparency and accountability? Because I listened to the IMF MD last week at the virtual meeting of the IMF World Bank spring meeting in Washington. She did say that a lot of monies are being used right now to fight coronavirus, but we should all keep the receipts, and transparency and accountability should be topmost, because this is also a process whereby for corrupt countries, so to speak, they will just be dishing out and nobody will ask questions. But we are asking questions. I am asking the question.
Well, again, you know that the team led by Aliko Dangote to date said they put about 26 billion. And don't forget that there was one again that they all set up put together that done almost about 33 billion commitments. And there are a lot of other groups that are doing their own support, those who are either working through giving food and palliatives. But one thing that is important is that I want to believe that one of the reasons why the private sector said they were not going to hand over money to government was because of their experiences in time past, whether through Ebola, flooding, Northeast, and all. So they too owe the nation a responsibility to ensure that after this event, at least for the sake of Nigerians, to believe that they actually gave those money and they used those money judicially to try and give us an account. The worry I have is the fact that these monies are put together if we have done significant analysis of what exactly do we need, where should we put priorities, maybe we'll have spent some of those money buying a lot of this text equipment. Maybe we'll have spent enough money planning the logistics of ensuring that food gets to people, rather than thinking about ventilators that we eventually didn't get much of that. So I agree with you. Nigerians will expect the private sector itself to give an account of the money raised and how they've used it. And I trust that we will have that at the end of the day. But again, this is where you need to commend the effort of the private sector, both big and large. More often than not, attention is paid to what the ALECO team and the NNPC team is doing, but there's a lot of Nigerians are doing. Yeah. I mean, even around the neighborhood, you see Nigerians cooks making food available. I mean, one will be proud to say you're a Nigerian because we really have stepped up to be our brother's keeper.
Yeah.
Look that alongside. So it's commendable, and we hope that we will overcome this COVID. But like you have said, the real work starts not after now, because significantly this is going to affect our economy. There will be no doubt the whole world is going to a recession, including Nigeria. How do we move out of one of the things we need to begin to think about?
Are you seeing new ways for us to beat this virus, vis-a-vis that we are also on a lockdown? And beyond that, everyone is on a lockdown now. What happens after the lockdown? Because with what I'm saying, I think we are into a week, the third week now of the 4 weeks lockdown. So the lockdown with the announcement from Mr. President, I think last week, will end next week. So after this lockdown, I'm also disturbed with what we're seeing right now. Oh, Mr. Jayola is the Skype has disappeared. All right, let's quickly take a break to reestablish connection. Okay, I'm being told he's back. Mr. Jayola, are you still there? Oh, okay. Let's try as much as possible to reestablish our connection. Let's quickly take a break. While we'll take a break, please do send me your comments on Twitter. You can also connect with us on Facebook. Talk to me about some of your concerns. You can find me on Twitter right now. Follow at Nancy Ilo and drop your comments as well as your opinions. We'll be right back. Okay, my guest is still joining me. We'll try to reestablish connection. The Chief Executive Officer at the NESG, Laoye Jayola. Sorry, sir, for that. I can see you now. Okay. My question earlier before the connection was off, I was asking if you are indeed seeing new ways for us to beat this virus beyond the lockdown. What happens after the lockdown in the next 2 weeks? So is everyone just hoping that the virus will just magically disappear and we all go back to our businesses with community spread going on?
Well, I think the virus is going to stay with us for a while, and nobody expects it to be gone in a week or 2 or 3. And which is why, again, it is important that we begin to find a way of moving out gradually. I mean, it's important that both government, both businesses should then begin to plan how to engage their staff and the people. What one will expect is that, again, if you take Lagos, for instance, there are about 3 or 4 areas that is considered to be very, very critical area. Maybe you will shut those areas and allow people to go in. maybe businesses will then begin to ask themselves, must we have all as our staff outside or a few of them? Maybe you think about how you open one market and the other market, but we need to begin to ease movements across as we go into next week and beyond. But what is important, what I will suggest to government is that it's important that everybody should have a mask on, because, and then we should still follow through with our social distancing.
What are the inhibitions to this social distancing, to this physical distancing? Because you've been hammering on social distancing, you've said it a few times in your remarks. What are the inhibitions?
For me, well, again, if people move all through, I was glad when they said that if you're doing a keke nape, for instance, then they're able to see that follow through. I'll be glad to see that even when the BRT starts in time, then you will begin to see that our roads are freer. I mean, I don't want to canvass things like go back to the old and even that we used to have in Nigeria, in Lagos. So some cars will go today, some don't go. But because people leave, so that you can do that you can do as you open the lockdown. But for people who live together in crowded communities, the best they can do again is, you know what, cover your mouth. Make sure that when people are coughing around you, they are coughing into a tissue. Wash your hands very clearly. Because some areas are densely populated that no matter how much you want to do a physical distancing, you can't keep the 6 feet that you want to keep.
How much economic catastrophe are we going to be expecting from this? Of course, Africa's economy will contract according to the IMF last week. Nigeria's economy definitely, perhaps will go into a recession. Or there's no perhaps there, because from what is happening now, the federal government, the Minister of Finance announced some policy fiscal stimulus measures that they've taken, close to $7 billion from different multilaterals. How much of economic catastrophe are we going to be expecting during COVID and post-COVID?
Just imagine the fact that when we did our budget, we thought we were going to do $57 to a barrel with about 2.3. Now we have rolled back. The OPEC approval for Nigeria is around 1.3, 1.4. Although when you started, you talked about what the oil prices are doing. But if you realize again that Nigeria has been finding it difficult even to sell our oil, and we offer discounts. So that 23, 24 isn't what you have. We're doing about 18 naira to. So if you have you can recover only 30% of your projected income from FX. That tells you that we're in deficit. But again, this we should begin to look at what should government be doing. How do you reflate economy in times like this? This is one recession that we need to spend our way out. I mean, you can see how much the whole of how much US pull out just within a space of 2-3 weeks. Apart from the 2 trillion, you saw what the Federal Reserve did, almost about 4
But they
trillion.
have the capacity to. US owns the federal owns the reserve currency of the world, so they can go ahead. But do we have that capacity? Do we print naira?
You know, I don't want to get into argument between the monetaries and the
fiscal.
gains. You know, time will come when we need to print some money. But again, the economists will tell us, even when we print the money, how well should we spend the money? But the argument is, maybe we've printed more than we should do. But no doubt, we need to begin to find how do we reflate this economy. Ordinarily, one would have expected that put the money in the hands of households. But in times like this, when household gets money, they tend to be very cautious and then they save that money. So you need to find a way to ensure this money is spent to make the economy to be able to come. The IMF had said that we will do a negative 3%, and they see us go out in 2021.
21.
I don't think that at all, because I haven't seen a time when we've grown by about 8-9%, 6 to 7-8%. So it's something that we're going to have to deal with this year and next year. And if we take the right policies, we'll probably be out by 2022. But no doubt there are tougher times ahead. And this is time you tell government to spend, and let's do the right policy. Maybe some will be lucky to have some money come our way as Nigeria, as a country.
Are you seeing those right policies being done now by the government? The Minister of Finance has announced about close to $7 billion from multilaterals such as the World Bank, IMF, AFDB. We are seeing central bank on one hand to doing what it's doing. The president announced an economic sustainability committee. There's an economic advisory council. There is a COVID-19. You know, all of this. Are you seeing a holistic policy or a holistic approach, let me put it that way, at attending to these problems wholesomely, so that we can, the health is also looked at as well as the economic side, and we all come out of it better?
What the minister is going to look for is just to cover the gap in this year budget. So it's not to deal with our recession and taking us out. The CBN is announced some palliatives, but whether they are sufficient enough is something we need to look at the numbers.
So that means we've not even started talking of how to get out of this, really, because the government is just hell bent on how do we just be able to get money to give to the states to share, to pay our workers and all of that. So we've not even started thinking on how we come out of this, really, and that's quite scary.
What we've done is, what we're looking for is how do we balance this budget for 2020. But we need to then begin to do, how do we run the economy and make sure we get out of it, particularly since this oil price is not something that is going to go away almost immediately.
Okay, one last question for you. In just a few seconds that you answer, how should we not waste this crisis?
I think we've talked about diversification. We've talked about made in Nigeria, backward integration. If there's any time we need to work hard at it, this is now. Because believe you me, the logistics of getting input, whether they are intermediary goods or not, it's going to be tougher. But if we can have companies scale back and then do backward integration, maybe we will come out very, very easily out of the problem. Again, we need to begin to go to our Greek and make sure that we can feed ourselves. Because one of the things that people are not paying particular attention to is the possibility of a food crisis.
Thank you.
If you look at this, you're already having challenge with locusts.
Yeah.
And if we don't go and plant and reap and have good harvest, it might be a challenge. So we need to look at all those areas. We shouldn't waste that. But more importantly, we should plan from the state level. The era of looking forward to Abuja for money is over. Every state can be viable. And every state should take this advantage to make sure the leverage or whatever resources they have in their jurisdiction and use it effectively to earn and create better life for their citizenry.
Thank you very much.
That's what we will.
Thank you very much for joining me this morning. Thank you. And continue to keep safe while I also try to keep safe too. Thank you. I'll talk to you soon. All right. I've been speaking with Laoye Jayola, the Chief Executive Officer at Nigerian Economic Summit Group. I just have 1 minute or so before I move over to the news studio. But let's take a few comments coming through on Twitter. Which 888 says, "Good morning, Nancy. I enjoy your program. Thank you and keep watching. My concern about COVID-19 is that our government is not being fair to Nigerians, especially FCT, Lagos and Ogun State, where the lockdown was directed by the president. We have been hearing of audio palliatives. Sam Diala says Lagos is under siege by hoodlums, robbers, and other violent criminals arising from the lockdowns. Residents of Abule Agba, Alagbado, Idimo, and other places cannot sleep. Lagos State government should look into this. I talked about it last week too on the program. Okay, let's take another one. Jesse says, okay, well done, my sister. Nice question you asked today. Thank you, and keep watching. Dr. Andrew says we must start doing things differently. Vaccines are far from reality, so we must find ways to still live with the virus. By knowing a large population status can help provide safety net for the total economic activity in this pandemic area. Our comrade Darius says, Mr. Laoye Jayola has spoken well. Lagos is not doing bad, but in my opinion, more attention should be given to northern Nigeria. Bonpin says government is planning to lift the lockdown by next week, but no significant policy in place to mitigate the community transmission of the virus. Marketplaces are not well organized, so is the transportation sector. You just talked about transportation sector in Ghana. They are using drones to facilitate transportation, to facilitate sampling. But that's the much we can take on this segment of the program. I'm getting out now. I hope to see you all tomorrow. Continue to keep safe. Wash your hands. Wear mask if you are going out. If you are going out, wear mask to protect yourselves and protect other people. Sanami is in the news studio right now. Sanami, it's already afternoon. Good afternoon to you, Sanami. How are you?
Very well, Nancy. And how are you? Quite a show you had this morning.
Yeah, quite a show. Quite a show. We really need to do better than we're doing right now to contain the contagion. I'm scared, I'm worried, and I'm disturbed.